Now let me discuss some more atypical antidepressants, the example of which we have what is called as Mirtazapine. Right, we have what is called Mirtazapine. So if you take this Mirtazapine, let me tell you the mechanism of action of this Mirtazapine. If you take this Mirtazapine, Mirtazapine is the drug which acts by inhibiting the presynaptic alpha-2 receptors, and thus it increases the noradrenaline and 5-hydroxytryptamine release. Okay, so this drug, it acts by inhibiting the presynaptic alpha-2 receptors. Alright, it acts by inhibiting the presynaptic alpha-2 receptors. So thereby what will happen? Thus it increases, right, thus increases noradrenaline and 5-hydroxytryptamine release. Right, thus it increases the noradrenaline and 5-hydroxytryptamine release. Due to inhibition of auto and heteroreceptors respectively. Right, due to inhibition of auto and heteroreceptor respectively, a point what you should remember, autoreceptors, right? So because they are inhibiting the presynaptic alpha-2 receptors, it is increasing the noradrenaline levels, that is your autoreceptor activity. But even though it is inhibiting the presynaptic alpha-2 receptors, this Mirtazapine is increasing the 5-hydroxytryptamine levels, that is your heteroreceptor activity. Alright, so this Mirtazapine, although it increases the serotonin levels in the synapse, there is selective activation of 5-HT1 receptors. Okay, so even though it is increasing serotonin levels, there is selective activation of 5-HT1 receptors at the synapse. Now, why there is selective activation of 5-HT1 receptors is due to antagonistic activity at 5-HT2 and 5-HT3 receptors. Okay. Now, a point what you should remember mainly is this drug, it selectively activates the 5-HT1 receptors. Now, therefore, because it is increasing the noradrenaline and 5-hydroxytryptamine, but which 5-hydroxytryptamine? Selectively it activates the 5-HT1. So therefore it is also known as noradrenergic and specific serotonergic antidepressant. Okay, so therefore it is, right, it is also known as noradrenergic and specific serotonergic antidepressant action. Alright, now the very important point regarding the Mirtazapine is, Mirtazapine, it has very minimal the sexual side effects compared to selective serotonin reuptake inhibitors. So minimum sexual side effects is seen with Mirtazapine compared with other selective serotonin reuptake inhibitors. This Mirtazapine, it commonly causes the other adverse effects like sedation, weight gain, lipid abnormalities and dizziness. Okay, so You see the adverse effects? It will cause sedation, it will cause weight gain, lipid abnormalities, and as well as dizziness. So that is about your mirtazapine. Now let me take up another very important drug which is called bupropion. Right, another important drug which is called bupropion. So if you take this bupropion, it is both typical and as well as the atypical antidepressant. This bupropion, it inhibits the uptake of noradrenaline and dopamine. Right, it inhibits the reuptake of noradrenaline and dopamine. Now this bupropion, it is metabolized to a substance which is called as amphetamine. Right, it is metabolized to amphetamine like compound, and this amphetamine, it possesses the excitatory property. Right, this amphetamine, it possesses the excitatory property. Now where is this bupropion used? This bupropion is used for smoking cessation. Okay, it is used for the smoking cessation as sustained release formulation. As sustained release formulation, right? But the problem with the bupropion is this bupropion can precipitate seizures at high doses. Okay, so at high doses, this bupropion can precipitate the seizures. Right? So these are the few points about the bupropion. We have another atypical antidepressant which is called as Nefazodone. Right. So if you take this Nefazodone, it blocks the serotonin uptake and it also antagonizes the 5-HT2 receptors. Right. So what they do? They block the serotonin uptake. This is one point. And another mechanism of action of this Nefazodone is it also antagonizes the 5-HT2 receptors. Right, it also antagonizes the 5-HT2 receptors. A point regarding Nefazodone is it lacks the anticholinergic effects and it will also cause or it will lack the agitation as well. Right, the advantage is this Nefazodone, it lacks the anticholinergic adverse effect. Not only it lacks the anticholinergic adverse effect, because the anticholinergic effect is seen with tricyclic antidepressants, that is not seen with Nefazodone, right? And it also lacks agitation, right? It also lacks the agitation which is seen with selective serotonin reuptake inhibitors. All right, so that is a point regarding the Nefazodone. All right, now a point is this Nefazodone, it has very short half-life. Right, very short half-life, and this is a hepatotoxic drug. Right, it is a hepatotoxic drug. So these are some of the atypical antidepressants. The drugs what we have is Mirtazapine. It acts by inhibiting the presynaptic alpha-2 receptors. Thus it will increase noradrenaline and 5-hydroxytryptamine release due to inhibition of auto and hetero receptors respectively. It will increase the 5-hydroxytryptamine levels, that is serotonin at the synaptic cleft, but it will selectively stimulate the 5-HT1 receptors. Now, because it selectively stimulates the 5-HT1 receptors, this mirtazapine, it is considered as noradrenergic and specific serotonergic antidepressant activity. And this mirtazapine, it has minimal sexual side effects. And we have another drug called bupropion. It inhibits both noradrenaline and dopamine, and it is metabolized to a substance called amphetamine, which is having the excitatory activity, and it is used for smoking cessation because of its sustained release activity. But the problem is, at high doses it can precipitate the seizures. We have a drug called Nefazodone. It blocks the 5-hydroxytryptamine reuptake, and it will also inhibit the 5-hydroxytryptamine 2, that is 5-HT2 receptors. This advantages, this Nefazodone, it lacks anticholinergic activity and it also lacks the agitation, and it is having the very short T-half, and it is a hepatotoxic drug. Now let me discuss some more atypical antidepressants, that is called as, we have a drug called Atomoxetine. Right? Now, if you take this particular Atomoxetine, this is also one of the atypical antidepressant, and it is a selective inhibitor of the noradrenaline reuptake. Right? It is a selective inhibitor of the noradrenaline reuptake. And where is this Atomoxetine used? Remember, it is useful for attention deficit hyperkinetic disorder. Okay, it is used in ADHD. Right? What is this ADHD? It is attention deficit hyperkinetic disorder. All right. So this is about your drug called Atomoxetine. Okay. Now we have another drug which is called as Duloxetine. Right, another drug which is called as Duloxetine. So if you take this Duloxetine, it is mixed noradrenaline and 5-hydroxytryptamine reuptake inhibitor. Right, it is noradrenaline and 5-hydroxytryptamine reuptake inhibitor. And where is this used? Remember, it is used in the treatment of chronic neuropathic pain. Right, it is used in the treatment of chronic neuropathic pain. Right, example like in case of diabetic neuropathy and fibromyalgia, it is used, the Duloxetine is used. So example is in case of diabetic neuropathy and as well as in case of fibromyalgia. This Duloxetine is used. So remember, this Duloxetine, it is a noradrenaline and 5-hydroxytryptamine reuptake inhibitors, and it is used in the treatment of chronic neuropathic pain. Example, in case of diabetic neuropathy and fibromyalgia, we use this Duloxetine. Now let me tell you some of the very important multiple choice questions in the antidepressants. First and foremost, you take the most potent blocker of the 5-hydroxytryptamine reuptake is paroxetine. So remember, paroxetine is the most potent blocker of the 5-hydroxytryptamine reuptake. Next, we have another multiple choice question. Least potent blocker of 5-hydroxytryptamine reuptake, that is bupropion. Right, bupropion is the least potent blocker of 5-hydroxytryptamine reuptake. Next, another MCQ. Most potent blocker of noradrenaline reuptake, that is desipramine. So remember, desipramine is the most potent blocker of noradrenaline reuptake. Next, we have another important multiple choice question. Least potent blocker of noradrenaline reuptake, that is mirtazapine. So remember, mirtazapine is the least potent blocker of noradrenaline reuptake. Next, another important multiple choice question. The most selective inhibitor of the 5-hydroxytryptamine reuptake, that is escitalopram. Remember, escitalopram is the most selective inhibitor of the 5-hydroxytryptamine reuptake. Next, you see another question. Most selective inhibitor of dopamine reuptake, it is bupropion. Remember, bupropion is the most selective inhibitor of dopamine reuptake. Next, you see another question. Most selective inhibitor of noradrenaline reuptake, that is oxaprotilin. So remember, oxaprotilin is the most selective inhibitor of noradrenaline reuptake. Next, you take the drug which is having maximum antimuscarinic activity, that is tricyclic antidepressant which is having maximum antimuscarinic activity, that is amitriptyline. Amitriptyline, it is having maximum antimuscarinic activity. Alright, next, atypical antidepressant which is having maximum antihistaminic activity. So atypical antidepressant which is having maximum antihistaminic activity is Nefazodone. Okay, next, another important multiple choice question. Maximum alpha 1 blocking activity is seen with Duloxetine, right? So Duloxetine, it is having maximum alpha 1 blocking activity. Alright, next, another important multiple choice question. We have a drug called venlafaxine. Remember, venlafaxine, it has minimum antimuscarinic, minimum alpha 1 blocking, minimum antihistaminic activity. So venlafaxine, it has minimum antimuscarinic, minimum alpha 1 blocking, minimum antihistaminic activity. Alright, next, you take the drug called Duloxetine. Duloxetine, it contains high muscarinic, high antihistaminic, high alpha blocking activities, right? That is an important multiple choice question. Venlafaxine, they have minimum antimuscarinic, minimum antihistaminic, minimum alpha blocking activity, whereas Duloxetine, it has high or maximum antimuscarinic, maximum antihistaminic, maximum alpha blocking activities. Alright, next, we have a drug called the fluoxetine. Remember, the fluoxetine is the longest acting antidepressant, whereas Nefazodone is the shortest acting antidepressant, right? Longest acting is fluoxetine, shortest acting is Nefazodone, right? So these are all some of the very important multiple choice questions regarding the antidepressants. Now let me tell you the uses of antidepressants in a form of a mnemonic that is called depression, right? Okay, now you take D, they are used in depression. You take E, they are used in enuresis, mainly we use imipramine. You take P, they are used in phobia. You take R, they are used in case of recurrent panic attacks. You take E, they are used in eating disorders like bulimia. You take S, they are used in case of smoking cessation, that is bupropion is used in smoking cessation. You take S, they are used in stress disorder, that is post-traumatic stress disorder, these antidepressants are used. Next, they are used in I, that is impulse disorder, kleptomania, they are used in case of a disorder called kleptomania, which is an impulse disorder. You take O, they are used in case of obsessive compulsive disorder. You take N, they are used in neuropathic pain. So these are all uses of antidepressants.